Let's talk a little bit about the functional medicine approach versus the conventional medicine approach. We're talking about diabetes right now, so we'll keep the topic within diabetes. If someone who's a diabetic would go to a conventional medicine doctor versus they come to you, what is the difference, and why should they come to a functional medicine doctor?
So it really depends on the alignment of the patient's viewpoint. There's some patients that just want a pill. They say, Doc, you know what? Everything you say is probably true. Give me my pill, refill my pill. I'm good to go. So, I mean, we can do that if that's what they want. One thing you got to remember, functional medicine is based on individual patients. We don't treat diseases. We treat patients. So if the patient says, Doc, you know what? I can't handle it. Just give me the meds. We'll do it. Because again, the patient may come back in 6 months and say, I'm ready now, or they may not. So because it's patient-centered, we don't look at a disease. We look at how can we serve the patient? How can we improve the patient's health outcomes? How can we give the patient more joy? Things of this sort. Okay. I think our sweet spot at the Bay Area Wellness Center is the fact that being a board certified internist, I'm really comfortable with the medications of diabetes. If they're on insulin, you got to be really careful when you're treating with these medications. And if a practitioner either doesn't have experience or doesn't have a license, then they may not be so comfortable as I am helping with insulin and all the different classes of diabetes medications that have exploded over the last 5 or 10 years. It's been remarkable. So what we do is typically our patients are on 1, 2, 3, 4, 5 medications. They may have a diabetic doctor, they may not, an endocrinologist. So if they come to me and want to look at a more natural or functional approach, then we'll start with trying to improve the terrain, try to improve what their background is. So how are they sleeping? What's their diet like? How much stress is in their life? Are they caring for anybody who's sick or has Alzheimer's? What are they doing to get exercise? I mean, you name it. So there's a lot of things we can do from a lifestyle perspective. So that's one thing. Second thing is, I think in the first years of the 20th century, we do functional medicine and we just overwhelm the patient. You got to do this, you got to do this, you go to this store, get this. And the patient walks out of there with 100 things to do. It's like, I can't do that, So in the last 10 years, we've come up with functional medicine academy coaches, and they really are the go-between between what the doctor says and then what the patient experiences in terms of implementation. I mean, many times I spend 1 or 2 hours with a patient, call them back the next week and nothing was done. And I consider that a failure on my part, because the object is not for me to tell the patient what I know. The object for the patient is to get better. Okay. So usually either a nurse or a high-level coach will come in and help integrate what I've said to the patient and break it down for day-to-day actionable items. So we can look at a patient and see they're overwhelmed with all the things we're asking them to change. You're not going to have a successful outcome. And if they're paying cash, or even if they're doing a group visit under an insurance model, we owe it to the patient to give them our best. And the success is based on the patient's ability to change, willingness to change, and to see the numbers go down and the life, the happiness and things of this go down. So that's one thing that's changed probably in the last 5 years.